Texans without health insurance, another 1.5 million could be added due to the COVID-19 pandemic. Many people either make too much for assistance or not enough to afford an insurance plan of their own. Channel 5's Thanvi Verma spoke with a Valley man stuck in the coverage gap.
When it comes to how many people are uninsured, the latest data from the Center of Public Policy is from 2015. I spoke to a representative from the CPP who was able to give me estimates of where the Valley's at when it comes to uninsured populations. In Hidalgo County, we're looking at an estimate of 80,000, from Starr County, 5,500, and from Cameron, 34,000. Earlier today, I spoke to a man whose story is just one of the many this data represents. Luis de la Cruz, a firefighter for a decade, a guy who loves serving his community. But behind these pictures, a guy struggling to be served by his own community.
When you see the big fires on TV, when you see all that stuff and you see those guys carrying chainsaws and the whole team hiking up behind them, no one ever stops to wonder if those guys have health insurance or not. And I guarantee you, half of them don't.
He says the health insurance he could buy from the force, too expensive. Last year, his car got hit by another in a collision, but now he's still being hit with bills.
For 6 hours, I got charged $19,000. The ambulance, the labs, the x-rays.
Just another reason why he doesn't see doctors even when he needs to.
I chronically get kidney stones, even though I'm really healthy. I drink a lot of water, but I just have to grin and bear it. Take some ibuprofen and drink a lot of water.
Laura Guerra Cardis is a deputy director for the Children's Defense Fund. She says many stay uninsured because qualifying for Medicaid is extremely hard.
They have to be extremely low income. We're talking making less than $320 a month for a family of 3.
She says this gap will affect more and more people in this pandemic.
Projections show that 1.5 million more Texans might become uninsured.
She says another reason people in the Valley stay uninsured, anti-immigrant rhetoric,
is partially related to anti-immigrant policies and rhetoric coming down from the federal level that have created some fear within the Latino community.
Guerra Cardis says if you have children or a disability, qualifying for Medicaid will have less barriers. To find out if you qualify for Medicaid, you can head on to the Children's Defense Fund website at childrensdefensefund.org. Thanvi Verma, Channel 5 News at 10.